Hello everybody, it's my pleasure to make a brief explanation for the article Occlusal deviations in adolescents with idiopathic and congenital scoliosis. Scoliosis is a three-dimensional deviation of the spinal axis and an orthopedic condition characterized by posterior abnormalities. The most prevalent types in China are idiopathic and congenital scoliosis. Idiopathic scoliosis is a diagnosis of exclusion. This condition is diagnosed only when the history and the clinical and radiological findings do not provide clear evidence for any specific etiology. The major types of non-idiopathic scoliosis is congenital scoliosis, due to malformation or faulty segmentation of the vertebrae. Epidemiology of scoliosis. Scoliosis is a progressive disease. An incidence of approximately 0.5 to 1 per thousand births has been observed for congenital scoliosis. Idiopathic scoliosis in children of school age and above primarily occurs in girls. Its prevalence is 1% to 2% among adolescents. In 1969, a dentist represented 3 cases to evidence a causal relationship between occlusion and scoliosis and vice versa. Many researchers confirmed that occlusal dysfunction may contribute to neck and shoulder pain, scoliosis, and trunk imbalance. And researchers found that patients with scoliosis have asymmetric features of malocclusion compared with the random population. And possible correlations occurring between body posture and dental deviations has been debated since the beginning of the 20th century. A number of literatures having concentrated attention on this issue. However, it is unclear whether there is an association between malocclusion and scoliosis except animal experiments. And the animal experiments prove that unilateral crossbite can lead to scoliosis. And this cross-sectional study aimed to investigate the characteristics of malocclusions in scoliotic patients through clinic examinations. 58 patients with idiopathic scoliosis and 48 patients with congenital scoliosis participated in this study. A randomly selected group of 152 orthopedically healthy children served as a control group. A total of 106 patients with scoliosis, including 58 patients with idiopathic scoliosis and 48 patients with congenital scoliosis participated in this study. Severity was significantly higher in the congenital scoliosis, which reflected a greater surgical treatment rate in this group. And the high proportion of patients showing class 2 subdivision indicated sagittal asymmetry of bilateral occlusion in patients with scoliosis. And in the sagittal dimension, the incidence of asymmetry in the molar relationship and canine relationship were significantly higher in the congenital scoliosis. And in the transverse dimension, the incidence of lower midline deviation were both higher in two groups than the value in the control group. And in the vertical dimension, the proportion of cases showing a candid occlusal plan in both groups were higher than those in the control group. So, we can come to the conclusion. Patients with scoliosis showed a higher frequency of asymmetrical malocclusions, which were most obvious in patients with congenital scoliosis, and these findings were probably related to the more serious spinal deformity and the longer courses of congenital scoliosis. However, hypotheses describing the correlation between scoliosis and dental-facial complex have varied in recent decades. The correlation was assumed to be based on the anatomic and functional connections between the dental-facial complex and the cervical vertebrae, where functional connections among the cranium, mandible, and cervical vertebrae were adjusted by visual balance and a gravity effect. Scoliosis is common, but idiopathic scoliosis causes no or only few complaints at a young age. So the article indicated that asymmetric malocclusion in adolescents may serve as a reminder for both patients and medical staff to evaluate patients for potential orthopedic problems. Early detection is important and makes a major difference in the choice of treatment. Now we have confirmed correlation between scoliosis and dental-facial complex, and now we are in process of further studies. Is there any correlation between scoliosis direction and mandibular deviation direction? Scoliosis patients showed a higher frequency of asymmetrical malocclusions. Whether there is a mandibular asymmetry, does the mandibular asymmetry represent structural asymmetry or positional asymmetry, or both? Thanks for your attention.